And I'm assuming you can see the PowerPoint, Eric?
Yes, I can.
Okay, great. All right, we are getting ready to go live on Facebook. And we are live. Go ahead, Commissioner.
Thank you, Shannon. Good morning, everybody. Wanted to give an update to the happenings of yesterday. We had a very busy day relative to public health and COVID-19 updates and concerns. So I figured a good time to do that. So why don't we go ahead and pull up the PowerPoint right now, Shannon? So let's go the next slide. Thank you, Shannon. Just a quick update. You guys get this daily, but you know that we have 42,305 cases of COVID through the last year and a half or so, and then 839 deaths. Currently, we've had 41% of our population in Lucas County start the vaccine, which is about 36% of the population. I wanted to focus in a little bit on this. This kind of gives a history of almost the last month of what's been happening in our community with cases. These are daily cases that we get in, and then we document. This does change a little bit as like from 5/12. That number will definitely change over the next 3 to 4 days. But as we get further back in time, they're more concrete. If we look at the middle of April, you definitely see that rise in daily cases. As we work through April and then into May, you do see this downward trend. We've talked about this, and that downward trend means less positive cases in our community, and then that represents kind of the downward trend in that reporting of 100,000 that the governor does every week. And we're continuing to see this downward trend. If you notice our averages, we're below that the 90.07 that we had the middle of April or so to the end of April, and currently we're around 63.21 over the last couple weeks. So you definitely see that our numbers are improving. They're still relatively high, but again, they are improving. Next slide, Shannon. Wanted to talk a little bit about, since the announcement yesterday of being able to vaccinate 12 to 15-year-olds starting today, and we are doing that. We started that campaign with our local schools and with inside of Lucas County. But I think I wanted to draw our attention to percentage of total cases in our community that represent those pediatric cases. And if you take a look, right now about 25% of our total caseload of confirmed cases in Lucas County are from those individuals that are considered pediatrics. And again, I think that's telling of kind of what's going on in the community. We're not seeing those older age groups that we were really focused in on at the beginning of the COVID issue. We're seeing less of those. We're seeing more pediatric cases, kids cases, and that average where we were, middle to high 40, that average of 40 to I think it was 48 years of age on the average of who's getting COVID is now really around 34, 35 years old. So we're seeing that shift down. And again, I want to make sure that the community understood that. Next slide, Shannon. This is a little bit more telling. Again, we've been keeping track of this for a while, but again, wanted to make sure that the community, parents and guardians of kids had the information that they needed to make a decision about getting their kids vaccinated. Of course, you know our stance in public health and my stance that any vaccination out there, everybody should have. So again, I really do support getting the COVID vaccine for now those individuals who are 12 and above. But 8 to 13, if you take a look at, came in second, and then it it came down on those other age groups. But what we're seeing here in Lucas County is that really the jump in cases really happens at 8 years and above. But again, we have a tool to combat that, starting at age 12 now, 12 and above, to be able to vaccinate those individuals. So you see, we walked through, if you would, the holiday season in January. We came down in February, but you've seen us ticking up a little bit in April. And we don't know exactly how May is going to look, but right now it's trending about the same as the first 12 days or so in April as in May. So again, I wanted to make sure that we had this out there for the community to understand what's going on, and again, make a educated and logical decision about getting those individuals vaccinated that can right now. Next slide, Shannon. And vaccine appointments, again, get the shot, coronavirus.ohio.gov. All Ohioans 12 and above are eligible now for the Pfizer vaccine. Please remember the Johnson & Johnson and Moderna are still 18 above. Again, you can schedule appointments, but again, we are accepting walk-ins at our facilities. Right now, as I stated early on, the idea here is to be working with our school systems while kids are still going to school, and parents have a little bit easier time of getting the vaccine for their kids at the schools. We're working with all the schools in Lucas County to be able to offer that. And starting today, we've launched that campaign. We'll be working over the next week or so to make sure that we get vaccines to those individuals that want them in the school systems in Lucas County before school lets out. Next slide, Shannon. So here are our clinics. Again, we can go ahead and post this. It'll be on Facebook, but we do offer clinics throughout the week. Again, please don't forget about the mobile option too with the TARTA bus. And again, thank you so much to TARTA for helping us out in this endeavor. Here's the bus schedule for the week of May 10th. Again, please, if you can post this, we'll be having it posted on our Facebook page. I think we might already have it up there. Again, there's options out there for anybody to get vaccinated. We have more than a vaccine within Lucas County that anybody who wants one, and really any type, can find it out there. Again, no appointment needed for the bus. Do want to talk a little bit about Toledo Fire and their great work on the partnership on utilizing the ambulance to do the same thing as we're doing with the bus and getting really into the community. So again, thank you to both the fire department and to TARTA for what they're doing with our mobile assets. Okay, let's talk a little bit about what happened last night. We learned about the same time that you did about what was going to happen in June. So the governor announced last night a couple things, and we should be very excited about this throughout Ohio, but specifically for Lucas County, because again, we're getting back to that normal life that we all want, and that really is going to happen June 2nd. Again, removal of orders is what we have right now from the governor. So again, those face coverings, that social distancing, capacities, indoor-outdoor events, those are all going to be lifted June 2nd. However, we're going to have some remaining orders for nursing homes, and again, for that data that we want to collect about what's happening in our community relative to COVID in the state. The idea here then too, which was very unique, is that we're going to be offering some incentives. At least the governor and the Ohio Department of Health are going to be offering some incentives for those who have been vaccinated, who's going to get vaccinated. So Ohio adults who have at least one vaccine are going to be entered into a $1 million drawing, and they're going to have 5 of these. I do believe it starts the 26th of this month. So that's very unique. And again, I think a nice incentive that if you're on the fence about getting vaccinated, this hopefully will get you to come to one of our clinics and get vaccinated. I think the other great thing is looking at those individuals who are 12 to 17, who again are getting vaccinated. They're going to have the ability for drawing of a scholarship, for 4-year scholarship for one of the state schools, as long as they get their first dose. And there's going to be 5 of those as well too. And so they'll be entered into that drawing. Again, I think these are nice incentives for those individuals who, again, who either have been vaccinated or who, again, are on the fence to get vaccinated. And as I mentioned, they're gonna do 5 of these over 5 consecutive weeks, starting the 26th of May. Shannon? With that, again, I didn't want to keep us a long time, but some great information from the governor last night. I think, again, we have a path set for us now. We have some end dates, but I think what we need to do is really talk about that COVID come June 2nd just doesn't evaporate. It just doesn't leave our community. We're still going to have to deal with it after June 2nd. But because people are getting vaccinated, because we're seeing numbers coming down, because I think what the governor said, we've worked so hard to get to this point, is that it is now time. It's time to again get back to more of a normal life, and we'll be dealing with COVID as it comes at us after June 2nd and into the future. And again, nobody has a crystal ball to say when COVID might be out of our community, if ever. But again, we're going to have to again deal with it. And I think as long as we have the vaccine and we have this community who's been so resilient, we're going to be able to handle it. So Shannon, I think those were all the comments today. Can we open up for questions?
Sure. Thank you, Eric. First question comes from Melissa Veitch with WTVG. So go ahead, Mel, ask your question, please.
Good morning, Eric. Thank you for having this update. We wanted to get a feel from you. Can you give us a more succinct outline of the plan to go into the different schools to give the shots to the 12 to 15-year-olds?
Yeah, Mel, again, I have to say this. Our school systems, public, private, it doesn't matter. Parochial, it doesn't matter. They're all fantastic, and they've been able to work with us on a number of different endeavors, and this is the next phase. We've been planning for the last couple of weeks with our school systems, all of them, to be able then to get into their schools and offer these vaccinations for their 12 to 15, and even those that are 16 and 17, 18 in their school systems who have not gotten the vaccine yet. If they want to go ahead and get the vaccine, they'll be able to. So the planning really is up to each school. So we've been able to work with each school a little bit differently. Some of the schools wanted to couple this with their second dose clinics for their 16 and 17-year-olds. And so we've been able to do that. There have been other school systems that wanted to, attach it to their pickup lines after school. So we've worked with each and every school to be able to tailor it a little bit differently for them and their needs. But in general, over the next, let's just say 2 weeks, we plan to get that first dose at those schools into those individuals in those arms of those 12 to 15 plus year olds to be able, again, to make sure that that vaccine gets into those arms before the end of school, so we don't have another barrier we're trying to bring them back.
Okay, thank you.
Sure.
Next question comes from Caitlin Durbin at The Blade. Go ahead, Caitlin, with your question.
Hey, Eric.
Hey, Caitlin.
I've been seeing comments from people who have already said they don't plan to be vaccinated, but they see these $1 million vaccine lotteries as a bribe, and it makes them even more suspicious about getting it and why the government is pushing the vaccine so hard. What would you say to them?
Again, those individuals who don't want to get vaccinated, I don't know if any incentive will go ahead and bring them to the vaccination pod and get vaccinated. I think what this is doing is offering an incentive to the community for those individuals who might be on the fence a little bit to say, yeah, you know what, I kind of want to get it, but I just haven't had the opportunity, or this is going to put them in a position where, I do want to get it. So again, it's not for everybody, and I think the governor understands that, but we're going to be able to tick that number up higher. In that percentage of who we need to get vaccinated. We got to remember, we've seen the toll that COVID has taken on our communities. And the only way that we're going to get out of this, if we don't have to deal with COVID to the extent we've had to over the last year and a half. And the scientific way of doing that is through that vaccination process. But we understand every vaccine that we have out there, you don't have 100% people taking it up. But as long as we can get enough of individuals out there to, again, make sure that those variants don't get passed around to each other so that they don't form another variant, which could be worse, then that's what we're striving for. I don't think it's a bribe, because if you don't want to do it, you don't have to. But again, it's an incentive. It's a way to say, yeah, you know what, I do want to get vaccinated because, this is interesting. I had a chance at $1 million or a scholarship. It's no different than what we did with the brewery. And again, the brewery was amazing. That we offer, the owner bought individuals who wanted to get vaccinated a pint of beer. I think we had over 60 individuals partake in that incentive program. Again, to each their own. And they have to make the decision whether they get vaccinated or not. But you're protecting yourself, your family, and your community if you do get vaccinated.
Okay, next question is from Amy Steigerwall with WTOL. Go ahead, Amy, and ask your question.
Eric, so with the removal of health orders across the state on June 2nd, is there any plan? I remember at the very start of this, there were mask mandates individually by cities, by counties. Is there any plan to do any of that in Lucas County? Or have you had any conversations with business owners about what that could look like?
Yeah, Amy, good question. I've had conversations with a couple business owners, some elected officials. So we're going to be taking, again, the next couple of weeks as we progress to June 2nd. Hopefully there'll be a little bit more guidance from the Ohio Department of Health. But, we're going to have recommendations, I'm sure of it. There's some hospitals that what they'll do is if you're not vaccinated for flu, that again, there's things that inside those hospitals you have to do, wear a mask or whatever it might be. So I think we're going to look at that, some of those options that some business already have and hospitals already have for flu that we might be able to piggyback off of. But again, I think what we just need to do is kind of take a step back and figure out what are some of the best recommendations. I think the best recommendations are the ones that are going to be able to, one, get us to live our lives. Still protect us a little bit, make sure that, again, we have something that, businesses or elected officials can fall back to and say, okay, this might be the best thing to do to give people options, but we need to get back to normal. And I think, at least from my point of view, that the big normal is going to be our next school year. And that's going to be really important to get our kids back going 5 days a week, playing sports, not having to worry about COVID. And so what are some of the things that we can also do to recommend to help the community make sure that happens? And our economy, again, that's so important. Make sure that our economy gets back up and running as hard and fast as it can.
So you don't, just to clarify, you don't see something like a mask mandate across the county being in the future, but it's kind of like a business building by building choice? Yeah,
and I think with what the governor said yesterday, they're going to leave that up to the businesses and companies' facilities to be able to make their own decisions on what they want to do.
All right, next question comes from Bree with WNWO. Go ahead, Bree, and ask your question, please.
Morning. So quick question, obviously with these variants that we've been talking about being more contagious, and then we have some vaccine hesitancy, not making it quite to 50% in the county quite yet. What concerns do you have of in a couple of weeks, people not wearing masks indoors and kind of all those things that we've become accustomed to that, you've been talking about have helped with the mitigation process?
Again, Bree, I wish the crystal ball wasn't so cloudy. I don't know exactly what's going to happen after June 2nd relative to cases. I can surmise that I'm sure we'll see a little bit of an uptick maybe, just because, again, there's going to be individuals who have been wearing masks and maybe not been vaccinated that are going to go out and possibly, again, become a case. So I think we're going to be so anxious to get back to normal that, again, we're going to do some things we did before COVID that we did during COVID that protected us from getting sick or having increased cases. But we'll see, we'll see how we actually respond after June 2nd. We'll have to be prepared for whatever happens. June 2nd is coming. June 2nd is coming without orders. And we're going to have to, again, deal with the situation in front of us. It is what it is. And we're going to have to make sure that at least from the public health perspective, the medical perspective, we're going to be prepared for whatever happens after June 2nd and into the future too.
A quick follow-up. Do you foresee, all of those safety restrictions being re-implemented if after, a few weeks, maybe a month, cases kind of get out of hand?
Again, that's going to be an ODH and governor call. But again, if we're kind of using the science that we all should be using, we're not seeing those individuals who have been vaccinated with, I guess, substantial breakthrough. I mean, we've seen some breakthrough, but not much. The vaccines, what that means is the vaccines are effective. We continue to ask the hospitals, are they seeing those really severe cases with those individuals that have come in and been vaccinated that have breakthroughs? So the science is telling us that as long as you're vaccinated, you're going to be able to protect yourself, your family, your community. And so I think as we go down the next couple weeks, we get more people vaccinated, we're going to be in a better spot. So we're probably not going to hopefully see the need for those mask mandates. I could, and again, maybe I shouldn't say this, but if there's a variant out there that is more contagious and it has more of a fatality hook to it, I could see that there'll be mask mandates or things or other things coming down the pipeline, but we're not seeing that right now. So I do not think you're going to see mask mandates if we continue down the path that we are, and we get to a better point with vaccination.
Thank you so much.
Sure.
Andrew Osmus with WTOL has a question. Andrew, go ahead and ask your question, please.
Hi, Eric. You just mentioned the need to follow the science. The original plan to lift the mask mandate in the state was data science-based, 50 cases per 100,000 residents. We're obviously getting closer there, but nobody can really know that we would get to that point by June 2nd. Do you think now is the right time to be lifting the mask mandate, to be lifting these orders when we haven't hit the set benchmark that the governor had originally set, again, based on science?
Yeah, again, the governor and ODH have looked at this. We've actually had several discussions over the last several weeks about that 50 number. What else should we be looking at? What should we do? And again, the science behind it is looking at the data that we have in front of us right now in this downward trend, this upward trend of vaccinations. Hopefully we see over the next 2 or 3 weeks that we see additional vaccinations. So we're going to see those numbers come down. I think what we're doing right now is looking at the science, projecting the trends that they're seeing down the Ohio Department, because they have better data than we do. We just have that local data we can point to, which we're kind of seeing the same thing here. And hoping that, again, that science and that trending and that analysis takes us to the beginning of June to say, okay, we need to relieve the issues that we have right now with those orders to get back to normal life. I will say this, it has to happen at some point in time, whether it's May 30th, June 2nd, June 3rd, whatever, it has to happen. We can't stay this course forever. And I think, Andrew, the thing we need to do is use the science that we have to, again, meet any issues that we have after June 2nd with COVID. And again, our hospitals are prepared for that. Public health, I think, is prepared for that. We had the vaccine. So again, we don't know what's going to come, but being prepared, it kind of has been our motto for the last year and a half. So that is not going to change.
I believe that is the end of all of the questions.
Great. All right, ladies and gentlemen, again, as always, have really appreciated you since January of 2020. Actually before that too, but really through this entire event, I can't thank the media enough for what you guys do. Seriously, you've been fantastic about getting the message out, good, bad, or indifferent. You've carried the water for COVID messaging, and I can't thank you enough. Thank you so much.